Hi, my name is Amanda Charlton, and I am going to talk to you about COPD and what you can do to manage the disease, especially through an exacerbation. COPD is a chronic inflammatory disease that causes the airflow in the lungs to be obstructed. Emphysema and chronic bronchitis are two of the most common conditions that contribute to COPD. Emphysema is a condition in which the alveoli at the end of the bronchioles are destroyed, causing the airways to collapse when you exhale, making it difficult to breathe. Chronic bronchitis is an inflammation of the lining of the bronchial tubes. This leads to your lungs producing more mucus, which causes further airway obstruction. Usually with chronic bronchitis, people develop a chronic cough where they have it every day. Sometimes it's productive and sometimes it may be non-productive. Some of the risk factors of COPD are prolonged exposure to gases or particulate matter, which could be caused from an occupational hazard. If you are working in factories or around chemicals that you're inhaling every day, tobacco exposure. This could be from smoking yourself, whether it's cigarettes, cigars, pipes, but also secondhand smoke does contribute to COPD and can affect your lungs, even though you're not the one smoking. Smoking with asthma puts you at an increased risk to develop COPD as well. An increase in your age. People start showing symptoms about at least 40 years old of the symptoms of COPD. Genetics may also play a factor with your alpha-1 antitrypsin deficiency. So sometimes this causes COPD as well. Signs and symptoms of COPD is shortness of breath, wheezing, unintended weight loss, a chronic cough, which may be productive or non-productive. Usually it's either white or clear in color. May have an increased risk for respiratory infections such as colds, pneumonia. Some people experience some swelling in the legs, feet, and ankles. Cyanosis to the lips and nail beds. You'll notice that you're not oxygenating very well, so your nail beds and your lips may become bluish in color. You're having an excess mucus production, which is making you cough more, and you're getting more of that the junk and mucus into your airways. There are many tests and diagnoses to check for COPD. One of the big ones is a lung pulmonary function test. It measures the amount of air you can inhale, and it checks to make sure you are able to deliver enough oxygen into your blood. This can be performed using a spirometer, which I'm sure you all have seen. If you tend to have a rib fracture or something, they use these a lot. And what you do is you blow out and then you inhale into the tubing of the spirometer and see what your level is, about how much you're able to inhale. A chest x-ray can show emphysema and also rule out any heart problems to make sure that you're not having a heart issue and instead of it being COPD. Also, CT scans of the chest are done. These will detect emphysema and can also be used to screen for lung cancer. Arterial blood gases. This is a blood test that's used to measure how well your lungs are bringing oxygen into your blood and how well it's able to remove the carbon dioxide. These blood work can be very painful. It's usually done in the radial of your arm, the radial artery. The blood has to come from an artery, not a vein, to get this reading. Other lab work that may be done is to test for the alpha-1 antitrypsin deficiency, and this will just be to help to determine if you may have a genetic disorder that is leading you to have COPD. Surgery can be an option. In rare cases, they do a lung transplant if the situation is severe enough and if the person is able to undergo surgery. Some other complications that are caused by having COPD is, of course, your increased risk of respiratory infections. You're more likely to catch colds, pneumonia, you're more susceptible to the flu. It is recommended that every person would get an annual flu shot and also keep up regular with their pneumococcal vaccine, at least to help prevent some of the infections. You may not be able to prevent all of them, but the more you can help, the better it will be for you. Another problem may be pulmonary hypertension, which is basically high blood pressure in your lung arteries, and this can be fatal. Heart problems, you're at increased risk for heart disease, especially if you're a smoker. You know that heart disease is correlated to smoking as well. Lung cancer, also depression. This is kind of out of the loop there, but people may not be able to go out and do their normal activities that they're used to, so they're inside a lot more, causing them to become depressed, not able to enjoy their life as they were used to due to the limitations they have now. One of the biggest treatment options is smoking cessation. This is the only way to keep the disease from worsening. Whether you start going to smoking cessation classes to help talk to people who are going through the same thing, or using a nicotine replacement, such as a nicotine patch or Chantix, the pill to help, with the cravings. There are also a lot of medications used in the treatment of COPD. One of your big ones are your bronchodilators, which are used as an inhaler. You have your short-acting inhaler, such as your albuterol, which is used before you would do any strenuous activity, whether you're going running or that, to help prevent an exacerbation. And then you'd have your long-acting inhaler, which is used every day to help maintain the disease. Oral steroids are used in the cases of a severe or acute exacerbation to help with the inflammation of the airways. Oxygen therapy may be needed. You will get your oxygen levels tested. They'll do they have you walk around with the pulse oximeter on your finger to help make sure your oxygen levels aren't dropping, and if they are, to see what they can do to help prevent them. They may also do a sleep study because some people tend to drop their oxygen while they're sleeping. So they'll check that and monitor that as well and see if you need oxygen therapy at home. Thank you for listening, and I hope that you enjoyed this PowerPoint.